Welcome to Channel 17, the Town of Colonie Government Channel.
Hello and welcome to The Money Factor. I'm Richard Naylor, your host. Our topic today is SSDI, Social Security Disability Insurance, and SSI. SSI is probably better known to most people, but if you qualify for any of these programs, it can be a very vital service and support to our income. Our guest today is Scott Transue. He's with the Disability Digest. Totally up on this. Sometimes I have a little trouble following some of the details. It is kind of complicated, but I'm sure we can get you to somebody that you can call afterwards. So let's see how we do with this, Scott.
Good to be here. Thank you for having me.
Well, we're really happy to have you here. We try to cover a lot of financial topics. We've talked about Social Security, many other things. This is a fairly narrow topic, so it only interests people who are either connected to someone older, I suppose, but then there's more to it than that, right? So let's get into it. What is Social Security Disability Insurance?
Social Security Disability Insurance is actually separated out into two different programs. Obviously, both of them are at the federal level. Social Security Disability Insurance covers somebody who is unable to work full-time because of a medical impairment or a combination of medical impairments. And SSDI, as a lot of people would understand it, is funded through FICA taxes. As you work and pay your federal FICA taxes, you pay into the trust fund, and provided that you have enough work credits to qualify to receive benefits through that program, if you can prove to Social Security satisfactorily that you're unable to work full-time because of your condition, you would be approved for SSDI. The Supplemental Security Income Program, which a lot of people will know as SSI, is a different program for disabled individuals or people with disabilities who don't have as extensive a work history and therefore don't qualify for the regular Social Security Disability Insurance. It's essentially a federal welfare program, for lack of a better term.
Okay.
However, you do still need to prove disability to their satisfaction. The benefit rate under SSI is approved annually by Congress. It is not based on your earnings. It's a flat rate, doesn't change.
And you didn't mention FICA on that one, so and I assume that that's not funded through the paychecks?
Correct. SSI is funded purely through general tax revenues. The SSDI is funded through FICA taxes that the person who has been working has paid into the system.
Okay.
Okay.
Now, it seems like on the face of it, you either work long enough and you get money because you've worked long enough, or if you haven't, you get money because they want to give it to you anyway. You must get more money if it's SSDI. Why would it matter which one you were in?
Typically speaking, unless you had been working in very low-paying jobs all of your life prior to the onset of disability, the amount that you would get under SSDI is almost always going to be higher than the SSI amount. The reason for that is because the monthly benefit is calculated by essentially taking your total earnings over your lifetime, going all the way back to that first job you had.
Just like they do when we get our Social Security statement.
Correct. And a great way to estimate that amount would be to get the Social Security statement that they mail you every year, right around your birthday, and look at your earnings history and simply add up how much you've made over the course of your working life and divide it by the number of years you've been working. And that would roughly...
So everything counts?
Everything counts,
okay.
Yes. Any kind of employment, self-employment counts because you paid self-employment tax, which is just another name for FICA.
Okay.
Okay. So adding up your lifetime earnings, dividing them by the number of years you've been working, that would give you a rough estimate of what your monthly benefit would be if you were approved under the regular SSDI program.
Now, did you mention a length of time that you've been working, or is it amount of money for the DI?
For the SSDI, in terms of the,
If I've worked 5 years, but I made $1 million a year, I probably don't need this, but I'm trying to have a ridiculously high number. Obviously, I would have made enough money.
what they do for SSDI is you have to have earned enough work credits to qualify if you become disabled. And the rule, the federal rule is that the first 20 of those work credits that you are required to have, and the number of credits increases as you get older, but the first 20 of those credits has to be earned within the previous 10 years of your working life prior to your disability occurring. And the way they calculate work credits is it's essentially you get 1 credit per roughly $1,200 a year of earnings. So you could earn essentially up to 5 credits per year, or I'm sorry, 4 credits per year. So if you've worked 5 out of the last 10 years, to really any degree, because we're assuming here only about $5,000 a year to get the full credits, you would essentially have met the 20 credit rule. And then any of the other credits that are required for you to have, you could have earned 20, 25 years ago. It doesn't matter. But they want the first 20 to be within the first 10 years prior to the onset of the disability.
So you take that as a first step.
Have you worked long enough? Yes.
And then they add up all the money that you put in, and now you know how much you might qualify for.
In a broad sense, yes.
It doesn't have to be exact, because just to give an idea.
The average benefit amount right now is about $1,000 a month. But it could be, in some cases, $800. I have heard of cases where the benefit was over $1,300 a month. For somebody who's worked a long time and they're, say, into their middle to late 50s, let's say, and suddenly disability strikes somehow and they're unable to continue. So there is a broad range, but on average, it's around $1,000 a month.
Now, there are other programs that the government has, such as Medicare, workers' comp, what else? If you just can't work at all or you're not working, they'll give you welfare. How did those interact with this?
Well, to get into the Medicare side, first of all, with SSI, the Medicare piece is automatic.
So that's the medical that goes with the supplemental income.
Correct. So with SSI, the Medicare aspect, the federal health insurance is automatic. With the SSDI, the disability insurance, there's a 24-month waiting period. From the month you are approved, you would have 2 years before you would qualify for Medicare.
Another donut hole.
Another donut hole, definitely, exactly. And with, you were talking about other forms of assistance that some people get. With welfare, like food stamps or temporary assistance or something like that, if you were approved for disability, and let's say that because of the length of time, and we'll get into that later on, I believe, the length of time it took for you to be approved, let's say you had 1 year of retroactive benefits coming to you. What the government will do is, because you were collecting food stamps and perhaps temporary assistance through your county, there's going to be an offset of your retroactive benefits to repay the county for the benefits that they provided you. Because in essence, if they didn't do that, you would be, in their words, double dipping. You'd be getting benefits through the county and then benefits from the federal government for the same time period. So they consider that to be essentially double dipping if that were allowed.
Now, does that money come out of what you would get, or it just goes back to a county that paid you? So you still get all that you had?
You are still awarded the retroactive benefits, but in terms of how much Social Security would send you in the form of a check for the retroactive pay, the amount that they are repaying the county would be taken out of that before you got the check. So let's say you were eligible for $10,000 in retroactive benefits, and you had gotten, let's say, $3,000 from your county through food stamps or otherwise, the $3,000 would be taken out of the $10,000 award before you got the check. So you would get a net check of $7,000.
Okay, so it is reduced.
Right, yes.
Okay. Okay, let's see. Disability, it means you can't work. Let's define that. What is disability?
A lot of people think they know what it is, and because they think they know, they don't always apply for it. Disability under federal law is the inability to either get or maintain a full-time job because of a medically determinable condition. A term that they love to kick around a lot at the federal level is substantially gainful activity, meaning that
Yeah.
if you are working part-time in some capacity, but you're earning below a certain threshold per month, Social Security can still consider you disabled. It doesn't necessarily have to be that you're unable to work at all, although some people, unfortunately, many people who do go on the program are not able to work at all. But the fact of the matter is that the real test is what medical conditions do you have, and how do they prevent you from getting or maintaining employment above that income threshold on a monthly basis. And right now that threshold is $1,000 a month. So if somebody, let's say, is working part-time and making $750 a month, but yet has condition A, condition B, and it's decided by their doctor that it would be better, for them to either maintain the part-time employment that they've got or stop working altogether, they're simply not able to work full-time. There's nothing whatsoever to prevent them from either applying for Social Security disability or from being approved for it, based on the part-time employment. It would not disqualify them working part-time.
So you mentioned a doctor, but who decides if you're going to get? Now I know that leads me to a later question. I don't really want to go there yet. We're going to talk about the process. I didn't want to go into the process so much as trying to really understand what disability is. Psychological, how broad is that disability? If I'm just really confused and I don't make sense at work and they say you can't function, does that count?
Disability itself is a very foggy area. A lot of people will say, I have lupus, I have fibromyalgia, I'm tired, I have bipolar depression, I have whatever the condition might be. And they will say, do I qualify for disability? And the answer always is maybe. It depends upon how the condition or conditions you have impact you on the job. Like you were saying, fatigue. If you're always tired, that would impact your ability to concentrate, probably finish projects, maybe even get to work on time. You might be out, you might be taking sick time more often than quote average. So certainly that could be a factor in their ultimately approving you.
I think a lot of times we think of it as, okay, I have a heart condition, or I lost my arm and my leg, so I can't, and I'm a welder, I can't do that anymore. And so if I've done those things, you think, well, I'm disabled. But this sounds more like, whatever it is, can you do it?
Yeah, it's a question of, Social Security kind of differentiates impairments in two different ways. First one is what's called exertional, meaning using your limbs, walking, standing, sitting down, whatever, anything involved with moving your body, okay? And I'm going to give you a very easy test here that people can use to kind of determine where they are in terms of how Social Security would view their ability to work. They call it the sit, stand, walk test. The two questions would be, one, how long can you stand up and even walk around before you experience pain, or before you have to sit down, or before you get dizzy, or before you get very tired? The second question is kind of the polar opposite of it. How long can you sit down at a computer or at a workstation before you have pain, your back starts hurting, you have to get up because maybe you experience numbness or pain in your legs and you have to deal with that? One of the tests that they will look for is if you cannot stand up and walk around for more than, say, an hour to an hour and a half at one time, if you can't sit down for longer than the same amount of time before you have symptoms where you have to stand up or do something, take medication, Social Security will look at that and say, well, there's only a few occupations that this person probably could do.
Right.
And they're limited to pretty much sedentary, assembly line, very low paying work. They will look at that in terms of your claim and say, if you can't, sit down for a data entry job for 2 hours straight before taking a break, the odds are that you can't adjust to any other kind of work either. So we're going to look more favorably on that kind of a case.
Okay.
Similar to getting up and walking around. If you're at a workstation standing up and you have to sit down after 45 minutes because you're tired or your legs hurt you or you've got back pain, same situation.
Okay.
Same situation. That's a hint.
Okay, so I guess to kind of sum up, that helps a lot.
Right.
Psychological things can matter. Does it have to be, say, a verifiable disease, like something in the DSM-4 for a psychological disease, or can it be something that's not officially defined if a doctor says you can't stand up?
A doctor has to diagnose you with something. There has to be an official diagnosis of something or a combination of impairments. Just for an example, let's say scoliosis, which is spinal issues, and let's say chronic depression. The scoliosis would come under exertional because it would affect your ability to stand up, walk around, that kind of thing.
And that's a disease.
It is a disease, absolutely. Right. The depression would come under non-exertional, as all psychological issues would. And the issues around psychological issues are concentration issues. Have you been hospitalized? Have you been hospitalized repeatedly?
Okay.
Very important as well, have you had trouble holding down jobs?
So it's the seriousness of the problem is, no matter what it is.
Yes. It's not the condition itself. It's the seriousness of the condition and how it affects your ability to maintain a full-time job.
Okay.
If you've been, unfortunately, let go or fired because you were calling in sick a lot, or because, especially in psychological impairments, you had trouble getting along with people, you were having outbursts at people, didn't know how to deal with authority very well, those all come into play with your claim. And those are all very important to put down. What I find is, more often than not, this is true in almost 100% of the cases that I have, of the people that I've talked to, people write more often too little rather than too much about what's going on. It's tough. I mean, it's tough to talk about what's going on that's wrong with you physically. But in terms of getting a disability approval, you need to be as forthright and as honest and as complete as you can be. I have condition A, condition B, condition C. I've been diagnosed, and this is how it affects me daily, and this is how it would affect me on a job.
This is not a time to be ashamed.
No, it's not. You really have to check your ego at the door, as hard as that might be. Mm-hmm. You really do have to check your ego at the door.
Especially if it has to do with something with work and getting along, and psychologically. This could be difficult for a person. They've already got a problem, and now they're told you almost have to cure yourself to talk about it in order to put it down.
Right, yes. What I tell people just about all the time is, when I'm talking to them on the phone about these things, is essentially you're dealing with a very difficult time in your life already, and that's understandable. But Social Security it's a bureaucracy. It's a giant federal agency that's getting cases from all over the country at one time, and unfortunately, and we'll get into this later, at the early stages of your application, you are unfortunately your Social Security number. That's how they're going to track you. That's how they're going to know you. You have to, get over that hump, so to speak, of saying, this is exactly what's wrong with me. This is how it affects me. This is the doctor's diagnosis, and I have other people's opinions here to show you as well about why I can't function full-time on a job.
Now, one more question before we get into that application process. Sure. Let's say I go back to work, or maybe the opposite. Well, let's do both. I go back to work, but I can't continue working. Now, am I done? Let's say I managed to get through 6 months, but then I'm going crazy and I can't do it. or my health keeps getting worse, or I get repetitive stress, and now my arthritis is so bad that it hurts just to move.
The answer to that is different based on whether you've already been approved for disability insurance or whether or not you have an application that's pending or you're thinking of applying. Social Security has another term that they use that they love to throw around, let's say, called an unsuccessful work attempt. And that is a period of time...
It's English, though. That's not bad.
Not bad, no. It's a period of time where you attempted to go back to work full-time, and let's say it was for 3 months. And you found that it was just too much for you, the pain was too much. If you had psychological issues, you were getting into conflicts with your boss or
maybe
with
you almost
coworkers.
had a couple accidents.
Correct, sure. If you attempted to go back to work for 3 months or less, and you had to stop because of your impairment, they will consider that an unsuccessful work attempt, and it would not impact your application, or if you have already been approved, it would not impact what's called a trial work period that we'll talk about a little bit later. If it's longer than 3 months, going into, say, the 6-month point, it does get dicier.
Okay.
Because
you did it
obviously,
6 months, you can do it forever.
if you did it for 6 months, why can't you do it for 9 months, and why can't you do it for a year?
Right.
That kind of thing. So that 3-month time period is really the key factor. Okay. If you stopped it, if you tried to go back to work and had to stop within 90 days because of your impairment, Social Security will say, okay, you tried, good for you, but we're not going to in any way punish you at all
So
for
it's
that.
very important to know that up front.
Yes,
so that you
exactly.
don't push through one more week and then fall apart.
Right.
Okay.
But the answer that I would give to the same question is different once you've been approved for disability.
Okay.
There's something called the trial work period that Social Security has in the law. And believe it or not, once you've been approved for disability, Social Security has all kinds of incentives out there that we'll be getting into, I'm sure, that will help you to go back to work full time if you would like to try.
Let's do those.
Okay, sure. The first one is what's called a trial work period. And essentially, and this might actually even surprise you, what happens is, let's say you've been approved for disability for 6 months, and you are offered a full-time job, and because of your resume and your work experience prior to the determination of disability, you accept the job and it pays $45,000 a year. Social Security will say, as long as you report it to them that you are going back to work, doing a job, and they'll ask you how much you're earning, and you can tell them that's fine, there's no issue there. What they will do is, on the trial work period, is give you 9 full months to test your ability to maintain that employment. And you will still get your full monthly benefit, no questions asked, for 9 months, as long as you are honest about it and you keep your pay stubs and you are willing to show them your pay stubs if they ask you.
Do I hear incentive here?
Absolutely, absolutely. So you could be making $4,000 a month. Your disability benefit was $1,000 prior to accepting the job. It will stay at $1,000.
Now you're making $5,000.
Now you're making $5,000 a month. You're getting essentially your benefit is not stopping for the first 9 months of employment as a way for you to test your ability to work full time. Social Security wants you
At least they
to go back to work.
They are getting 12% now of your pay.
That's right. That's correct. That's correct. So for the first 9 months, there's no issue at all with your benefit check. At the 10th month, what happens is they will say, okay, your trial work period is over now. You go into what's called a 36-month re-entitlement period.
Okay, now we have 3, now 6, 9, and now we have, 36.
Yeah, right. So we've been back to work for 9 months with full benefits. Now we're into the 10th month. Social Security will send you a letter saying, are you still working at this job? Obviously, you would be honest and say yes if you are. And they would say, okay, you're entering your 36-month period of re-entitlement. What that means is very simple. For the next 3 years, for any month that you are earning above that substantially gainful activity level,
Okay.
which if you were making $4,000 a month, you would be way over.
Right.
For any month in which you are earning that amount of money or more, you would not get a check from Social Security. But let's say that 18 months in, you run into a roadblock with your health and you have to stop working. You decide you can't do it anymore, you have to stop working. The 9-month trial work period has passed, and essentially 9 more months of the 36-month re-entitlement period.
You're halfway.
Well, not halfway, but.
Okay, so that 36 adds on to the 9.
Right.
Okay.
Right. So you're 18 months into your job, but you decide that you can't do it anymore. You call Social Security and say, listen, I had to stop working because of my condition. They will reinstate your monthly benefit without a new application, without a new doctor's statement, without anything. It's called the 36-month re-entitlement period. Right.
So that's the real benefit.
That's the real benefit.
That to fall back on.
Right. So you've got that 36-month buffer where if you do have to stop working because of your condition, they will reinstate your benefits without another application or without any more doctor's notes or anything like that.
That sounds good.
Yes.
Whereas 6 months sounds like it's a rule of thumb that I use for a lot of things. If you can stop smoking 6 months, why can't you do it 7, just like we talked about?
Correct. Right.
But 3 years, now that's
Right.
pretty significant.
Now, to go further, once the 36-month period has gone by, you enter into what's called a 5-year expedited reinstatement period.
Okay, that's a hard word. Exponetic?
Expedited reinstatement.
Oh, expedited.
Expedited
Okay.
reinstatement, they call it. So you've been through the 9-month trial work period. You're okay. You've been through the 36-month period where you've been able to maintain. But let's say once those 36 months are up, let's say a year later, okay, you have to stop. Something happens, your condition worsens, whatever it is where you have to stop working because of your health. What Social Security will do is you will call them and say, listen, my 9-month, and they will have this in their records. I've used up my 9-month trial work. The 36-month period following that has gone by, but this happened, I've had to stop working because of my health, and I don't know if I'm going to be able to go back. What they will say is this: okay, fine. What we can do is this. We can expedite a reinstatement of your benefits.
Okay.
You still have to apply again, but the typical waiting period, which I don't know if I addressed yet or not.
We're going to do that next.
Okay. The typical 5-month waiting period that you would have for SSDI is waived.
Okay.
In that case, you still have to put in a new application and gather your medical records and such.
But while they're looking at it, you've got something to live on.
While they're looking at it, you have your benefits reinstated. Now, the catch-22 there is if they decide, listen, you're no longer disabled, you can go back to work. By our rules, whatever benefits you were granted would have to be repaid.
Oh, wow.
Yes.
Okay, so that 6 months is not a free ride.
It's not free. It's not free.
You could pay it back.
It's conceivable that if you were denied, if they said you were not disabled, that you would have to
Still some strings attached.
Some, yes, some.
Okay.
But, at least it's something while they're determining.
Now, we've gotten some clues from what you said before about some parts of the application process. The time seems a little surprising in some cases. But let's take us through, from the very beginning,
Sure.
the process. What do you do first?
What I always recommend, if somebody is able to do it, is to actually go into their Social Security office. If it's in Albany, be down at the O'Brien building. Go up to Social Security and say you want to file an application for disability insurance. They will say SSDI or SSI. I would recommend both, just to make sure that they have it on file that you've applied for both. Even if you don't think you're eligible for both, go ahead and apply for both. You can always retract one of the applications
Excellent.
later on. Yes. The reason I recommend that somebody goes in and does it in person is very simple. If you have a very obvious impairment, loss of a limb, you are blind, you have trouble hearing, anything like that, they will be able to notice that. And they will, in your application, when you're talking with somebody and they're getting just the basic stuff down, they will note in the application something like claimant showed signs of blindness, or claimant had difficulty standing up, or claimant obviously has loss of the right arm or the left arm or what have you.
Right.
They can see you. And it makes it easier later on when you are answering the questions of why can't you work full-time.
Right.
Okay. Rather than somebody simply going online, filling out a 2 or 3 line internet form and submitting it. The computer can't. The computer program doesn't see you.
No notes.
No notes. All they know is what you're typing in. They can't see you. So it's important if you can to go into
And
the office.
since we have this in Albany, it's not that hard.
No, very simple. It's very simple to do it. You just go to the office and say you want to put in an application for SSDI and SSI, and it's very short initially. It's only they'll ask you a few questions, and what happens at that point is one of their workers will go through and if you're applying for SSDI, see if you have enough work credits for your age group to qualify.
And that's cut and dry.
It's cut and dry, yeah. If it's SSI, they will look into your other income and asset. They call it resource test.
Okay.
For SSI, well, let me backtrack. For SSDI, there is no test of any kind other than the inability to work full-time.
Right.
Okay. For SSI, there are a couple of other tests that come into play for basic eligibility. One of them is you cannot be earning above the substantially gainful activity level, which is the same thing as SSDI. But with SSI, the other test is what do you have in terms of resources? If you're a single person, you can have resources of $2,000. If you're married, the resource test can be as high as $3,000. They allow you to have a house, they allow you to have 1 car. The real issue is how much money do you have in the bank, and do you have access to other funds somehow that you could easily cash in, like a life insurance policy if you wanted to, that has cash value or something like that.
And that money's, even if you had $4,000, that's not going to last very long.
No, it's not. It's not. The way they look at it is SSI is meant for people with very limited resources who don't have the work history to qualify for SSDI. So they are going to look at resources, essentially money in the bank.
And they may be on other programs.
Correct. Yeah. They're going to look at money in the bank, essentially. So it's $2,000 for a single person. If you're married, it goes up to $3,000.
So is it better to wait until you don't have any in the bank?
What I tell people is if you have a substantial amount of money in the bank somehow, like $5,000 or $6,000 or $7,000, in order to comply with application requirements, you're going to have to disclose that, obviously. If it's a purely SSI case, then they might want to wait, sure.
Now, if it's something like a 401k or an IRA, would that still count in the means test?
My sense is it would not count because that is restricted funds that are
Okay.
only available upon retirement age, unless you
Another
borrowed
benefit
against
to
it.
these things.
Sure, yeah. What counts as what they call countable resources is something that's better for SSA to handle directly.
Okay.
What I can tell you is that for one person, the resource limit is $2,000. For a married couple, it's $3,000. But in terms of exactly what counts as resources beyond simply money in the bank,
You really need to go through it.
you really need to go through their office and they'll explain it to you.
Okay, now you filled it out.
Mm-hmm.
Do I get my check next week?
Filled it out, and what's going to
Is that
happen?
what they do?
Unfortunately, no. Unfortunately, no. What's going to happen is typically about a week later, once you've put in your application, you're going to get a call from a Social Security worker. And they are going to go through the application that you submitted, verify birth date, verify Social Security
In the
number.
meantime.
And they are going to ask you about your work history, assuming you have a work history to demonstrate to them. And just go through and verify a lot of that information. It's all very basic. And
To bring your patients.
yes, yes. It's pretty much done over the phone.
Okay.
They typically don't call you in.
I
It's
see.
typically done over the phone. Once they verified basic eligibility, meaning this person has enough work credits for SSDI, or they meet the requirements for SSI, including, they're within the resource limits. What's going to happen is you're going to get in the mail this fairly hefty package, and it's called an Activities of Daily Living questionnaire. Unfortunately, it's very detailed. It's probably between 10 and 15 pages long, And essentially what they are going to do is ask you, okay, Richard, or okay, Scott, tell us how you spend your day. Can you get out of bed okay? Do you make your own meals? Do you socialize with people? What do you do all day? And in conjunction with
Don't
that,
say 3 hours at the gym.
correct, correct. Very, very true. What they will also look at, they will ask you to list employers for the last 15 years, because that's how far back they go, typically, on an application. And they will ask you, what percentage of the time did you sit? What percentage of the time did you stand up? Did you use computers? Did you have to climb? Did you have to, stoop, kneel down? All of these different things. They will get very specific about what you had to do in terms of using your limbs and your body. And they will also talk about potentially psychological type issues, trouble concentrating. They will get into, have you ever been terminated from a job? If you have, why? That kind of thing. They will get into, do you belong to any social groups? Do you spend time on the internet? Really, just to get an idea of what can this person do right now?
So they're going to match that up with
Sure.
what kind of jobs
Correct.
might be available.
Correct. Essentially, it's their way of determining, even with the conditions that you have, what is it that you are still able to do on a daily basis?
Okay.
And how does that match up with, as you were just saying, the kinds of jobs that are available in the economy that you could conceivably do?
Okay.
Okay. One of the easier tests to meet, like I said previously, was if you can't stand up or sit down for more than an hour at a time without pain or having to do something to alleviate the pain, they're going to look at that and say, well, there isn't very much that this person can do. And they're going to have a hard time denying an application that's backed up by medical records demonstrating that.
Okay.
Okay. So somebody with purely psychological issues like bipolar disorder or chronic depression or something like that, what they are going to look for is how long are you sleeping every day? Do you have days when you just don't get out of bed at all? Because
So they need the severity of this again.
yes. Do you go outside? Are you phobic? Do you have panic attacks? If you run into problems with other people, do you run home and just stay there for a day or two because of fear? That kind of thing. It's not always easy to talk about. Again, check your ego at the door. If you're having trouble even leaving your house, they need to know that. If you're having trouble with preparing your own meals, if you're having trouble getting along with people, you find yourself getting agitated or you find yourself getting angry a lot for things that the quote-unquote average person wouldn't necessarily get that angry over, that's something you need to tell them. Okay. Again, check your ego at the door.
Okay, so now this is going to take place after you fill out the form. They're going to evaluate that.
They're going to
I see
evaluate.
time passing here.
You're looking at between the time you initially file the application and you have your 15 or 20-minute phone interview, and then you fill out this big mammoth package of forms, sending that back in, you're looking at easily 3 to 4 months here.
Wow.
Yes. And a lot of times what will happen is Social Security will do what's called ask you to go on to a consultative examination. What that means is if you get a letter saying that they've scheduled that for you, you need to pay attention to it, you need to keep the appointment. What they're saying is we know what your doctors are saying. We want you to talk to a doctor you've never seen before, and we want his or her opinion of your conditions.
Okay.
Okay. You don't pay for it. It's a free exam. If you have trouble with transportation where you can't take the bus over or you need to take a taxi, Social Security will cover the cost of the taxi if you can't take the bus or get over there some other way. They will cover the cost of the taxi for you. And it's, again, unfortunately, kind of an impersonal exam.
On the other hand, it sounds like they're watching over our money.
They are watching over our
Social Security doesn't
money.
want fraud here.
That's correct, they don't. And what they're doing with that consultative examination is simply getting a third-party opinion. Is what Scott's doctor is saying in terms of what conditions he's claiming, does that match up with what you're seeing in Scott. If he has scoliosis, let's say, is the curvature to the extent that he's claiming? And we want another person verifying it, not just Scott's doctor.
Great.
Okay. It is definitely a quality control mechanism, but I will say this about it as well. I have seen very, very few cases in the work that I do with people where a consultative examination by itself tipped the scales in favor of an approval. It typically does not tip the scales in favor of an approval.
It would go the other way.
It could definitely go the other way.
Right.
Absolutely go the other way,
Right.
but it typically will not make or break an approval.
Okay.
Okay.
So where are we now in terms of time?
We are probably at the 4 to 5 month point. Social Security gets the report back from the doctor that they had you see, and they hopefully by this time will have gathered all of the medical records that are necessary to back up your claim. I would highly recommend that people, when they're going through this process, Social Security will say, okay, give us the names of the people you see for your conditions and we'll get the documentation. Don't assume that they're going to get all of it. That's not a criticism so much as it is just a fact of reality. Go to your doctors if you see more than one. If you only see one, go to your doctor and say, listen, I have a claim in for Social Security disability. Number one, would you support me? Typically the answer is yes, if a severe condition. Number two, would you please have your nurse or office person make copies of my medical records? I'll be happy to sign a HIPAA release and make sure that they go to the necessary office.
Okay.
Okay, please do not assume that Social Security will gather all the documentation. It's not that they don't want to do it. It's not that there's some scheme to not do it. It's that it's overwork and understaffed. It's that simple. And I can almost guarantee you that if you're not on top of getting all of those ducks in a row, something is going to get missed.
Those ducks will wander off. Yeah.
They'll wander off. Something will get missed, and it could make the difference between getting approved and not getting approved.
It sounds like we're half a year now.
Yes, most initial decisions will take anywhere between 6 and 9 months, unfortunately. Nothing any of us can do about that. It's just the way it goes.
I'm surprised. Maybe I shouldn't be.
To Social Security's credit, one thing that they have started doing is something called presumptive disability, where if you are diagnosed and you can show proof of this, of certain conditions, they will approve you for benefits pending a full approval by their staff.
Okay.
It's a very limited number of conditions. I couldn't even begin to tell you what they are. The obvious ones are not on there.
And you really don't want them anyway.
That's correct. If they've made that list, they are extremely severe conditions. The one that I know of is end-stage renal cancer, end-stage kidney cancer. That's an automatic approval. I've seen people approved for that in 3 weeks.
Okay.
Because of that in 3 weeks. The other ones, the more common ones like scoliosis or bipolar disorder or any of the more common things that you would hear people unfortunately suffering from, vast majority of them have not made that list yet. That doesn't mean they won't in the future, but at this point they have not.
So what percentage of people get approved?
Unfortunately, on the first application, you're looking at no higher than about 30% approval rate. So maybe 1 in 3. That's a national rate. Some areas of the country are even worse. They're 1 in 4 or 1 in 5. The reason for that is not so much that you don't have a valid case, but typically quality controls at Social Security will look at approved cases. In other words, they don't really care how many cases people are denying at Social Security. They won't look at denials. They won't do audits of denials. They will do audits of approvals on the first application. So unfortunately, it's just the culture. It's the culture of the organization where
they hate those. I don't know if it's a false positive or a false negative, but they don't want to give the benefits to somebody who might not deserve them.
Correct.
But they're going to allow people who should get them to not get them yet.
They are going to err on the side of caution every single time. And it results in, yes, people with very valid cases get denied the first time around. Very valid cases. It's unfortunate, but it happens. It happens much more frequently than you would realize.
Okay, well, what do you do with those other 70% if you said quite a few of them actually
Right.
really would qualify?
Right. Quite a few of them would. And what happens is the next stage, unfortunately, New York State has stopped this particular stage, but I want to talk about it anyway. There is a stage called reconsideration, where what happens is an examiner looked over your file at the first application, denied you. What happens is if reconsideration is a possibility, it will go, your entire file will go to a second examiner who has never seen your case. It's brand new to them.
But it's another person in the same office,
Correct.
so to speak.
Yes, it's another person in the same office. They will look over your case file, and they will make an independent determination, approval or denial. Denials at the reconsideration stage are even higher, because they really, in most cases, typically don't have any new information to go on.
And we don't have that anyway, so
Right, right. What New York State has done is bypass the reconsideration stage completely, and your case would go to an administrative law judge hearing. Okay, you have to request it. It's not automatic. You do have to request an appeal, and you have, I believe, it's either 60 or 90 days once you are notified of your denial to ask for the appeal.
what
And all
kind
you
of judge is that?
administrative law.
I mean, where would he be? Would that be?
It would be, it's a federal judge.
Federal judge, okay.
Yes. It is not in the federal building. It is in another building in downtown Albany that I would prefer not to give away.
Okay.
The reason they do it in a separate building from the federal building is because they don't want people who are coming in for hearings to be just completely blown away by the whole experience of going in front of a judge.
Okay.
It's in a separate building that does not look
So it's
legal.
more gentle.
It's much more gentle, yes, much more gentle. You have to ask for the hearing, and unfortunately, because of backlogs, you're looking at least 1 year to get in front of a judge.
Wow.
Yes.
Okay, now we're 12 and 6 to 9, so
But it can easily, from the day you file that initial application to getting in front of a federal judge, if you are denied and you want to appeal it, you're looking at
easily 2 years.
easily 2 years, in some cases 3 years.
So you
Yes.
said check your ego at the door. You better check your patience and
Yes.
make sure you've got it.
Yes. And quite frankly, at the hearing stage, we strongly recommend that you get representation, not because we want to make sure that lawyers get more business. The reason is because federal judges are going to decide whether or not you have a case or not, and whether you should be approved. The judges themselves all have different viewpoints of what they would consider to be a valid case and what they would not consider to be a valid case. And there's an old saying in law schools: a good lawyer knows the law. A great lawyer knows the judge. Somebody who practices disability law full-time is going to have been in front of these judges weekly. They know what the judge is going to look for. They know what the judge is not going to like to see. And they're going to know the kinds of questions that the judge is likely going to ask. So the claimant wouldn't know any of this because this is their first time through the system.
Right.
They're not going to know anything about this. So the reason we recommend that you get an attorney, and preferably somebody who practices only disability law is good, is so that you get the benefit of the attorney's experience with this particular judge. For example, I know of attorneys in the area who will call people that they are representing, say, a week or two prior to the hearing, and say, Scott, come on in. I want to prep you for Judge so-and-so, and this is what to expect. These are the kinds of questions he or she is likely to ask you, that kind of thing. And if there are potentially negative aspects to your case, meaning things that could sway the judge towards a denial of your claim, if there are ways for you to answer those questions
In a little more favorable light.
In a more favorable light, the lawyer will know that too. Yes. This has nothing to do with deceiving anybody or being untruthful. It has to do with presenting your case and your situation in the best possible light to a federal judge who has the sole power to grant you benefits or deny you.
Now, we're talking about a long time you've been working towards this. What percentage of people, more or less, have success with the judge?
exactly the opposite of the success rate with Social Security
So
itself.
out of that 70% that may have gotten denied, maybe 70% of those will get,
I would say if you are going in without a lawyer, I would say your success chances are about 65%. They go up well past 80% with an attorney.
wow.
Yeah.
Well, now you're up to about 90% of the
Yes.
cases.
Yes, indeed. But again, the 80 or 90% success rate on appeal in front of a judge, that assumes that you bring an attorney on board who knows their stuff about the law, about disability law. If you're going on your own, which I don't recommend, it's about 65% chance. So you're adding 20 to 25% to your
Probability of
to your
success.
probability of success if you have a good disability lawyer on your side.
Now, a scary question.
Yes.
Are you going to get any money for the time that you haven't been awarded anything, or does it start when the judge says, oh, well, you should have been awarded this SSDI?
Let's say, for sake of example, that you applied January 2nd, 2010.
The first time.
First application. You got denied, and now you're into the hearing stage in New York because we don't have reconsideration, and it's been 2 years. It's now January 2nd, 2012.
12, that's right. I'm
Yeah,
going
2
too
years.
fast.
And you're now in front of the judge, and the judge approves you all the way back to your initial date of application,
Okay, that
which they
sounds
have.
positive.
They have the full right to do that. If you can prove that you were actually disabled prior to the date of your application, they call it the alleged onset date, you can be approved for benefits 1 year prior to your application.
And that you wouldn't have gotten if you had
Correct.
been approved with the first one.
Right, correct. So the judge could say very positively for you, you're approved all the way back to your initial date. So now you have a 5-month waiting period in which you don't get benefits at all from the date you apply for them. So let's say it's January 2nd, it's 5 full months from the date of application, it's the waiting period. So your first paid month would be July. February,
And
March,
now I
April,
want to
May,
make
June.
clear that we're only talking now about the DI.
Correct.
Disability insurance.
Correct.
Right.
There is no waiting period on SSI. You
Right.
are correct.
Right.
So you would be getting 24 minus 5, 24 months minus 5 months waiting period on SSDI in back pay. Social Security rules.
Makes me feel better. I mean,
course.
it would make a person feel much better after.
Correct. I mean, just for sake of example, the average retroactive payment right now is 12 months. So if your monthly benefit is $1,000 times 12, that's $12,000 in retroactive pay you have coming. Now, if you had a lawyer represent you, they are entitled to 25% of that, no more,
Oh, that's good.
by Social Security law. They can only charge you 25% of your retroactive pay for representing you.
So they're going to work to get that retroactive pay then,
Yes.
I would assume.
They are. No, they earn every penny of it, trust me. They earn every penny of it. And so let's say your back pay was $10,000. Your lawyer would get $2,500 and you would get a check for $7,500
Okay.
in your back pay. The lawyer does not touch your current month's pay, current benefits going forward.
And that's going on, right?
That's correct, yes. So let's, hopefully, I always tell people that the absolute best chance of getting an approval is unfortunately at the hearing stage, because the agency is so notorious for denials on the first round. It's not an indictment, it's just the way it is. So your chance is going to be in front of a judge, and you should have somebody of legal training next to you.
Wonderful.
Definitely.
You've done a great job. I want to really thank you. That was not an easy one. And I think it's become much more clear.
Well, I appreciate that. I appreciate that.
Thank you, Scott.
Thank you so much.
I hope you enjoyed the show. I hope you tune in again next time and that you have a great week. Take care.
Welcome to Channel 17, the Town of Colonie Government Channel.